Dear friends, my name is Dr. Igor Atabekov. I am clinical oncologist practicing since 2010. Today I want to talk about immunomodulator called Panagen. It's a Russian made immunomodulator that can be used in oncology patients. Actually, it's undergoing the phase 3 trial now. And in phase 2 trial, it showed really significant results. So I want to tell you a little bit more about this drug. Let's get started. Oncology patients have some issue with immunity. Otherwise, most likely their tumor would never survive the immune surveillance. That's why it's very important in these patients to work with their immunity. That's why oncologists often use immune modulators. These are substances that can affect the immunity. They can be natural, they can be synthetic, but they may actually improve the outcomes of those patients. We know that Panagen is the fragments of double-stranded human DNA that are obtained from human placenta. And when they come to human body, they will affect immunity. They will stimulate dendritic cells. Dendritic cells are the cells of innate immunity, non-specific immunity. These are antigen-presenting cells that will present pieces of tumor to lymphocytes, to specific immunity. And lymphocytes will train, it's like the SWAT. It's a special, very specific, very strong actors that will act on this tumor that they were trained against. And we know that this Panagen can increase dendritic cells and can increase cytotoxic lymphocytes, CD8 cells. Okay, that is preclinical things. What can it do in actual patients? Russian scientists from Institute of Cytology and Genetics in Siberia, they held phase 2 trial on patients with breast cancer, stage 2 to stage 3. Those are the groups of patients that need chemotherapy as prophylaxis, but also their therapy is aimed at the potential healing of these patients. So we remove the tumor, we use radiation therapy, we use chemotherapy, we use hormonal therapy, and we hope that this person will be totally healed. Unfortunately, we know that many patients will relapse in sometime in years or in months. That's why, of course, we are always searching for something that can decrease this relapse rate. So we know that immunomodulators may be used in oncology patients, and during chemotherapy, for example, they can improve the functioning of the patient. They can, for example, protect leukocytes. That's why the patients, their investigators from Russia, they decided to check how this immunomodulator Panagen will help those patients will help those leukocytes in the patients undergoing chemotherapy. And really, they found out that intake of Panagen really helped to decrease the incidence rate of significant drops of leukocytes and neutrophils, drops of immunity. And as the bonus, they found out that hemoglobin was dropping less. Also, they found the hepatoprotective effect. That means that the liver was not as much affected by chemotherapy. So these are already good results. But what makes this immune modulator so unique compared to all the other immune modulators? I will tell you now after telling how was this investigation held. They took 80 patients with breast cancer, mostly stage 2 to stage 3, and some were getting Panagen, 5 milligrams tablets, 6 tablets a day, meaning 30 milligrams per day. And the others were taking placebo pills. And 1 day before chemotherapy, it was cancelled. Then they got chemotherapy with doxorubicin, red chemotherapy. And then 2 days after, they were restarted with Panagen. Then they were getting until the next course. 1 day before the next course of chemotherapy, it was cancelled again, and then restarted again. Like that. and they found the results that I told you. Protection of immunity of leukocytes, protection of erythrocytes and hemoglobin, and protection of liver. But afterwards, after this was done, those patients, I told you already that this is radical therapy, the stage 2, stage 3, we expect that those patients will probably be totally healed. And those patients were monitored for 5 years. Will they have relapse or not? And this is the most interesting now. For stage 3, patients' relapse occurred in 3 from 4 patients who got placebo, meaning only 25% of patients with stage 3 breast cancer will not get the relapse in 5 years. But those who were receiving Panagen, 1 in 2 got no relapse, meaning 52% of patients didn't have any progression of the disease. That's very interesting. Even more effect was observed when they did a deeper analysis. They took stage 3B and 3C. Stage 3 is divided into several categories. For example, 3A is not as bad as stage B and stage 3C. And if they compared stage 3B and 3C, more aggressive, not more aggressive, like more like worse stages, they found out that in 5 years, 17% only won't have relapse in placebo group, and 50% in Panagen group won't have relapse. So it's a really significant increase, meaning that Panagen can really decrease their probability of having their disease relapse in future. Now this drug is undergoing the phase 3 trial. It's not a very fast process, it takes years also, but hopefully it will show good results as it showed in phase 2, and it will be registered for use in oncology patients, and the oncologist can also recommend it. Nowadays this drug is unavailable for buying, but there are some clinics, integrative medicine clinics, that actually can use it, but of course it's a very costly process. So let's wait until phase 3 trial is done and the drug is registered. I'm very excited about it. Dear friends, hope it was interesting for you. I wish you good health. God bless you. Bye bye.